Any single-shot technique for a brachial plexus block has a failure rate. It is therefore important to be able to top up a single-shot technique with more peripheral individual nerve blocks where appropriate. This video demonstrates the vertical infraclavicular approach to the cords of the brachial plexus as they lie lateral to the first part of the axillary artery before they take up their named positions around the second part of the axillary artery lying beneath pectoralis minor. The mid-humeral approach is then demonstrated for the median, musculocutaneous and radial nerves. This combined technique is especially useful for patients with painful shoulder joints who would have difficulty abducting their arm to allow either access for the mid-humeral approach or for the duration of surgery.
Right, we'll just stick that in now and we'll just leave it there.
What we'll be able to do first of all is, if I just support a head, let your head fall back in my hands, we just support your head and gently feel the subclavian artery. And if you can feel the subclavian artery, that's a good giveaway. So there's her subclavian artery just passing under the clavicle there. And let her head back down again. And then what we want to do is find the midpoint between the sternal notch and the tip of the acromion. And the easiest way to feel the acromion is to place your hand beneath the shoulder and feel the spine of the scapula, and then come round the top of the shoulder, feeling the acromion as you go until you feel its tip. And then check that you're feeling the tip of the acromion and not the greater tubercle of the humerus by externally and internally rotating the shoulder. And then you mark that midpoint, and then your approach is immediately perpendicular to the floor with the patient in the supine position. And you're going to be passing the needle through skin and subcutaneous tissue. It's going to pass just above the upper border of pec major and just above the upper border of pectoralis minor, and then you're going to pick up the plexus. And you get an idea of the depth of the plexus, the depth that you felt the artery. So we're probably going to pick up the plexus at about 2 to 2.5 centimetres. So we've got a marker pen there. Do you want to feel those landmarks and you make those marks?
It's on 2. Take your finger, honey, on it. Just takes away, it's going to be delayed.
Yeah, so the greater tubercle humerus is there, isn't it?
Is more lateral,
yeah,
is more easily palpable, but it's
yeah,
the wrong thing to feel.
Yeah.
So you make a little mark where the
There's the crease there. You go like that, that's our midpoint.
So you'd like to get your hands washed. We'll set up the nerve stimulator. So we'll switch it on.
We need ECG pressure as well.
To 2 milliamps. It's now in the stimulating mode. When we make electrical contact with the patient, it'll go up to 2 milliamps.
A little scratch now. It's about the same as it was in your hand. It's coming now.
So it's perpendicular. That's it. Slowly. then cautiously advance it. So that's direct stimulation of perhaps pectoralis major. So you want to slightly advance the needle. Right, just gently hold your hand, just relax your hand, that's it. Slightly advance the needle, Paul. Does that feel as if it's into your hand?
There's something, isn't it? But it's, I feel it's something into my hand.
Let me just reduce it a little bit more. But it all seems to be more pectoral movement, so slightly advance the needle, Paul. You're on 0.4.
What do you feel?
I just felt you going through
Right.
better.
Go a little bit further, slightly advance the needle. We'll just turn the current up.
Felt like I went through a fashion.
Right. Just let go of the needle and see what's happening. There, that's her fingers moving there.
Right. Yeah.
Now what you've got to see is whether if you push the hub of the needle towards her feet or pull the hub of the needle back, whether that finger movement increases. Finger movement increases. Now just very, very slightly, that's 0.9. You just turn the current back. Just very slightly advance the needle. Slightly advance it.
Yeah, that's going on.
Okay, that's looking good. Do you want to aspirate and then inject? That's stimulating the fingers at 0.5 milliamp. Is it easy to inject? Goes immediately.
Yep.
Gently aspirate to make sure you can't aspirate any blood.
No.
And complete the injection. Well done. You may have a feeling of water running down your arm. Careful injection. We'll complete the 30 mils of cryophyll. Then what we'll do is we'll put our arm out and you'll pick off the radial and the musculocutaneous nerves with 0.5% bupivacaine, because that's the main area where the surgery is going to be. And approximately at the level of the insertion of the deltoid muscle would be your puncture point. And then just a centimetre or two proximal to that, you want to do a transverse subcutaneous infiltration of local anaesthetic from just above the artery to the posterior fold of the arm. And infiltrate it as you advance the needle. Infiltrate as you remove the needle, that's excellent. That's fine. Just,
All of it? Oh.
yeah, just infiltrate another 3 mils as you remove the needle. Gently advance the needle. You've got flexion of the wrist and the fingers. I'll turn the current down a bit. Do you want to just slightly advance it and see whether it improves?
Yeah.
I'll turn it down a little bit more.
You okay there?
There's no pronation to that. That's on 1 milliamp, that's on 0.8. Slightly advance it. That's looking good. Hold still.
So
There.
is it?
That's right.
Well done. That's on. That's 0.5. Aspirate, please, Angus.
and gently inject. It's easy to inject, completely pain-free, and that was the medium.
You alright there?
Mm-hmm.
I'll turn the stimulation back up again. You want to withdraw the needle to the skin, raise it vertically, and go down medial to the artery to pick up the ulnar. Pass the needle, and almost vertically. That's right. So it's like that. Don't press on the tissues. So you're going to pass medial to the artery and pick up the ulnar nerve. Don't press too hard on the tissues. You're going to pick up the ulnar nerve as it goes posteriorly. It's not subcutaneous, so you want to raise the needle. Now, if you can't immediately find it on that pass, then in the same way that you found the median nerve, you want to advance the needle so that it goes obliquely across the medial surface of the artery. So again, aiming towards the axilla, the posterior part of the axilla, gently advance it and see if we can pick up. If you can't immediately find it, because we've probably got it with the bib injection, you can look for musculocutaneous, which is going across the top of the artery and just across the top of the humerus. And if you can squeeze the tissues together with your left or your right, with your left hand, put your fingers into the... Now go across the top of the artery towards the upper surface of the humerus to pick up musculocutaneous and coracobrachialis. That's good. We're on 2.3. That's it. A little bit more. That's it. Let me just turn the current down. 1. A little bit more, Paul, just to make it look a little bit stronger. That's flexion of the biceps. Advance it just a little bit more. That's not uncomfortable, is it? Advance it just a little bit more. Try and pick that up a little bit more accurately.
Losing it there.
Okay, come back a little bit. And decide whether you have to go more superiorly or more inferiorly. Okay, that's on 1.5. That's good. Aspirate and gently inject. That's good.
Disappears as you...
And you want to come back to the superficial tissues, subcutaneous tissue, and you're going to pass beneath the artery, again towards the insertion of deltoid, just touching the posterior surface of the humerus to pick up the radial nerve. That's it, well done. Pull the tissues down, well done. Advance the needle. You're doing very well. If there's anything uncomfortable, just say. Is this okay?
It's fine.
You may want to make another puncture. You tend to lose the artery once you've injected some medicines. Or your landmark is the posterior surface of the humerus. In you go with the needle onto the humerus. Aiming towards the insertion of deltoid. Come back and aim a little bit more superiorly, because you actually want to touch humerus to know that you're just posterior to it. There we go. Well done. Can we pick up that stimulation on the video? Well done. That's a radial movement, so extension of the wrist, turn the current down. Slightly advance the needle and see if it improves. That's on 0.5. That's looking fine. You can turn the current down a bit more. And threshold is about 0.3, so that's good. Aspirate, please, Angus, and gently inject. It's easy to inject.
You okay there?
Fine.
That winds around the humerus, doesn't it?
That's right, in the spiral groove. Well done, Paul. How'd you feel? Payunk Medical Technology produce a range of equipment suitable for regional anaesthetic techniques using nerve stimulation to aid accurate localization. A range of needle tips and lengths are manufactured through which catheters may be passed for prolonged analgesia. A choice of stimulating or non-stimulating catheters are available. The facet-tipped needle with a 20-degree bevel allows easy passage of a catheter when the needle is in the same axis as the nerve or plexus. This would include an axillary approach to the brachial plexus or a block of the femoral nerve. The TUI tip or sprott tip allow the catheter to exit at an angle which may be useful for interscalene and vertical infraclavicular approaches to the brachial plexus or with a catheter technique for the lumbar plexus.